In family planning, other than using condoms, birth control pills, injection becomes an option for women who don't want to get pregnant. Contraceptive injection, or its brand name Depo-Provera, acts to release hormone progesterone into bloodstream, preventing pregnancy in women. The injection is injected intramuscularly, commonly at the upper arm and the lower buttocks, every 11 to 13 weeks. So the question is, what will happen to the woman, causing her to not have pregnancy? First, the ovary does not release eggs. Second, thins the lining of the uterus, preventing implantation. Third, thickening of the mucosal layer at the uterine opening blocks the sperm passage. Now that we have covered all that, who is suitable for this method? First is women who don't want to take birth control pills, women who don't want to take estrogen and contraceptive implants, women who are committed to a 3-monthly appointment with the doctor, and not for women who think they might be pregnant, plan on conceiving a child the next year.
Now, the advantages of contraceptive injection. There are a lot of benefits related to this method. Each injection provides long-term protection, which is 3 months against pregnancy. Many women stop getting their menstrual period while getting injection. This is not medical problem, and menstrual period usually returns 6 to 18 months after taking an injection. This contraceptive injection is reversible birth control option. If you want to get pregnant, just stop taking the and it is highly effective if use it correctly. It is a private and discreet contraceptive choice. Nobody has to know that you use injection because there are no wrappers or pill compounds. It permits sexual spontaneity and does not interrupt sexual activity. Upcoming is the disadvantages of contraceptive injection. It does not protect you from sexual transmitted diseases, so use a condom along with the shot to help protect yourself. The women that take this injection may experience some short-term side effects such as weight gain, tiredness, mild pain, and possibly a decrease of bone density. Furthermore, they need to see a doctor every 3 months for an injection. And they may also have very irregular menstrual bleeding or spotting for the first 3 or 6 months after taking this injection.
So, how to administer Depo-Provera? Depomedroxyprogesterone acetate, or known as Depo-Provera, contains 150 mg per ml. Both the 1 ml vial and the 1 ml pre-filled syringe of Depo-Provera contraceptive injection should be vigorously shaken before use. This is to ensure the dose being administered represents a uniform suspension. First, withdraw 1 ml from the vial that contains the recommended dosage of 150 mg Depo-Provera. Then, it is injected through deep intramuscular site either in deltoid or gluteal muscle. Must rotate the injection sites with every administration. Depo-Provera gives protection for 3 months, therefore, the patient needs to take a shot for every 3 months to continue protection against pregnancy. To ensure the patient is not pregnant at the time of the first injection. The first injection must be given only during the first 5 days of normal menstrual period, within the first 5 days after giving birth if not breastfeeding, and lastly, at the 6th week after giving birth, if the patient is exclusively breastfeed.
Another type of contraceptive injection is Noretrat. It contains hormones such as progestin and northestrone enantate. So, what is the difference between Depo-Provera and Noretrat? In terms of dosage, Noretrat is 200 mg. Meanwhile, Depo-Provera is 150 mg. The duration of action between those two injections are also different. Noretrat can last for 8 weeks, which is 2 months, but Depo-Provera can last longer, which is 12 weeks. approximately 3 months. Although Norris rat is unable to prevent sexually transmitted diseases, you can still get gonorrhea, herpes, and even chlamydia after sexual intercourse. Similar to Depo-Provera, Norris rat is administered intramuscularly at the muscle of buttock. Besides that, it is given during the first 1 to 5 days of menstruation. The hormone, progestin, will be released continuously into the bloodstream over 8 weeks. Ovulation is inhibited due to its effect, thickening of the cervical mucus and thinning of the uterus lining. Of course, there are a few no-nos when it comes to contraceptive injection. Firstly, being pregnant or suspected pregnancy. Next, having unknown cause of bleeding from vagina. Besides that, being currently diagnosed with breast cancer or having the history of breast cancer. Having history of stroke is also contraindicated in contraceptive injection. Another contraindication is ever having blood clots in arms, legs or lung. Next is having liver disease or liver damage. And the most importantly, having allergy towards ingredients listed in the contraceptive injection.
Side effects of birth control injections. Irregular bleeding or spotting which leads to amenorrhea. It's common to have headaches when taking birth control injections. Other than that, an increase in body weight is another common side effect. A person may feel nauseated and vomit after taking the injection. Depending on the person's hormonal changes, the injection can affect her sex drive. She may experience a decrease in her libido. Another serious side effect is loss of bone mineral density, especially if a person has osteoporosis or at risk of having osteoporosis. Other side effects include feeling of depression, breast tenderness, swelling or scarring at the injection site and hot flushes. Precautions. For Depo-Provera, you have to inform if you have any known allergies towards the medication. Second, it is not advisable if you have history of breast cancer because it may be hormonally sensitive. Third, it may cause some degree of fluid retention, so it is not advised if you have kidney or heart dysfunction. Caution for breastfeeding mothers because published studies reported presence of Depo-Provera in the human milk. If you have history of depression, you need to be carefully observed because it may recur. Depo-Provera may also cause vaginal bleed. For Norris rat, it may cause liver cancer in long-time users. Blood clot may also form in your blood vessels, causing restrictions of blood flow and bleeding. You may have increased risk of coronary artery diseases with predisposing factors such as cigarette smoking, high cholesterol level, obesity, diabetes, and increasing age. You also will have increased risk of congenital abnormalities.